Welcome everybody. Let us discuss today about significance of bite marks in snake bite. Practically bite marks are of no use in the treatment of snake bites. Usually they are misleading. The two bite mark theory, that the age old concept of venomous bites must be of two fang marks, is a purely misnomer. It is misleading. Not only misleading, it is causing a lot of difficulty in treating snake bite cases. Usually, venomous bite marks may be from 0 to 3, 4, anything in number. In common crate bites, there may not be any bite marks. Actually, the very fine mosquito like bite in the deep night, in the sleep, there will be no bite mark, but the patients come to us in the morning with different types of symptoms like pain abdomen, sore throat or anything else. Let me show you this patient. This 40-year-old patient came to us, referred from a peripheral hospital with a diagnosis of Guillain-Barré syndrome. But he was moving his leg and hands, that led me to the diagnosis that it is not a case of Guillain-Barré syndrome, but presence of ptosis made me to diagnose it to be a case of common crate bite. But the relatives strongly opposed my diagnosis. They are repeatedly telling that he was not bitten by a snake, but he was admitted, and after the admission ticket was made, the relatives admitted that he has told them that he was bitten by a black snake in the garden. Practically he didn't tell that he was bitten. He stepped over a black snake 25 hours back, but he totally ignored the bite, as there was no bite mark, no pain, no swelling, which are usually seen in cobra bites. Ultimately, this patient was saved by treatment for snake bites by infusion of antivenom. You see, this another patient. This patient is a 14-year-old girl. She came to a rural hospital of West Bengal in the early morning with complaints of pain abdomen and a loose motion single time. The doctor got bilateral ptosis and he was confident that it was a case of common crate bite, but her relatives didn't agree. They were arguing and they asked the doctor to show bite marks. As there were no bite marks, they didn't allow to give her antivenom, and ultimately this girl died. You see, another lady of Assam, she came to a private hospital with complaints of sore throat. See the number of tests done for her. Nearly 50 types of tests were done. 2 times CT scan of brain was done, but no diagnosis was there. Someone suspected it to be a case of common crate bite by looking to the eyes of this lady. There were bilateral ptosis, and then the lady gave the history that one black snake crawled over her leg. So, if you go for searching bite marks, you will be misled. Now see another case. This is a case of Russell's viper bite, but there was no history of any bite. He came to the rural hospital for suspicion of septic in the thorn peak areas. He is locating the thorn peak like area by the pain. He had a history of a thorn peak like sensation in a bush of grass, and he had found one dead dog skeleton was there and he suspected it to be a case of prick by the tooth of the dog. But the lady doctor on duty, Dr. Savitri Hasda, suspected it to be a case of Russell's viper bite, and she had done 20 WBCT, the clotting test, and blood was not clotting. So she diagnosed it to be a case of Russell's viper bite. She infused 20 vials of antivenom and referred the patient to Bakuda Medical College. Their antivenom again was given. He went to total renal failure and ultimately died. So, significantly, bite marks are of no use. You see the first slide, from the first slide I have shown you deep bite marks and bleeding from the feet of this girl. She gave definite history that one snake wrapped her leg and had bitten, but there was no local sign or symptom. We had admitted her for 24 hours. We had done repeated 20 WBCT and blood was clotting. Actually, it was a case of dry bite. So, don't search for bite marks. Bite marks are misleading. Venomous bite marks may be of 0, 1, 2 or multiple numbers, maybe a scratch. There may not be any bite mark in crate bites. So, try to forget 2 bite mark theory. Thank you all.